DAPA-HF is a study with an SGLT2 inhibitor, dapagliflozin, in patients with heart failure and reduced ejection fraction. The study was designed because the drugs were like the SGLT2 inhibitors had previously shown and suggested a clear benefit in diabetic patients with and without heart failure, especially on heart failure endpoints. The study was specifically designed at heart failure patients with and without diabetes in this case, and showed a 26% reduction in the cumulative endpoint of mortality and hospitalization. It's a very stunning 30% reduction in hospitalizations for heart failure, which is extremely significant and has a very important role for its cost effectiveness especially, and an 18% reduction in cardiovascular death. This effect was not affected by diabetic status. That means that the effect was consistent in diabetics and non-diabetic patients, thereby suggesting that besides its anti-diabetic effect, the SGLT2 inhibitors and dapagliflozin specifically has a specific effect on heart failure. We had suggestions, as I said, from earlier trials with dapagliflozin and empagliflozin that there was an effect on heart failure. So we knew that there was probably a positive effect in diabetics, but these data complement and expand those data as they've shown efficacy in patients with and without diabetes, and specifically in patients with heart failure. So basically they prove once and for all the efficacy of dapagliflozin in patients with heart failure, and expands to patients without diabetes, with heart failure and without diabetes. This is for sure has a very important relevance in terms of treatment, because now we have treatments like ACE inhibitors, beta blockers and MRAs that have a significant effect on reducing cardiovascular mortality and morbidity. And we had a hype for the past few years on the effect of sacubitril valsartan on reducing events. And of course that can be used only in patients who have used previously an ACE inhibitor. Now, the dapagliflozin was effective in regardless of background therapy. Patients in the study were very well treated, and therefore suggests that in all patients with heart failure, we should be using dapagliflozin in order to reduce future cardiovascular events. But also in the future we'll know whether this intervention in those who are not diabetics will also reduce the occurrence of diabetes, which is a very significant comorbidity in patients with heart failure. So basically is a very exciting moment. We have a new drug, it's new in class for heart failure, and I think we should be implementing as much as possible its use. I think that for cardiologists, data like the one that have been, I think that for cardiologists, the data of DAPA-HF are more than enough to implement from today its use in all patients with heart failure. And I think that we don't need any more data, we don't need any more convincing evidence. I mean, probably we will need, and we will have in the future, the data on the efficacy of these drugs in preserved ejection fraction. We still is an area where we don't have any treatment, as sacubitril valsartan failed recently to show any meaningful benefit in patients with heart failure. So we'll have to look for that. In terms of cost effectiveness, the drug is very cost effective. It's more cost effective of any other new anti-diabetic medications like the DPP-4 inhibitors or the GLP-1. Now with this data on mortality, its cost effectiveness is even more evident, and I think that at the present cost, which is lower than many other cardiovascular drugs, its use should be implemented in all patients without any restrictions.